Hey there, it's Dr. Cammisa. Welcome back to our video series. And today we're in the lab and we are working with adipose-derived fat stem cells. So if you're new to our channel, stay tuned. We're going to take you through the whole process here. Subscribe, hit the updates, and stay tuned. We got lots to share. What you're seeing here are the tools that I set up my supplies in the lab. So we have several syringes here with just saline solution in a larger syringe size and also a smaller syringe size. But this device here from Joint Tech Labs is the magic science behind how we can purify, concentrate, and process the adipose-derived stem cell for the microfat injection. And this is an incredible device that is minimized our lab time. What you're seeing here is, this is Dr. Izzari, and he is injecting tumesic formula in the syringe into the posterior flank area to numb the area. This location here is going to be where he's going to use a special needle to harvest the fat. And in fact, over here, you see we use a special syringe here that has the ability to create a vacuum. And this vacuum is then going to create a suction that allows the fat, as it's broken up, to be sucked up into this syringe so that we can then process that microfat in the lab for the injection. What you're seeing here is the tumesic formula separating out from the fat. And now we're just going to be left with the fat. So step one in the process, you see here I got 4 syringes in a syringe holder. And you'll see here that we have the fat on the top, the orange colored product, and on the bottom the reddish. That is the anesthesia separating out. And so there's different amounts in each one of these little tubes here. So I'm going to drain out that tumesic formula is what it's called. And you see how yellow this one is here. And then I have one more tube here. So there's quite a bit here. So I'm going to drain all the anesthesia out. I'm going to mix it together. I'm going to let it sit one more time. And then we're going to combine it and start to process the fat into the Joint Tech patented fat processing system here. So the first thing I'm going to do is I'm going to extract the tumesic formula. We're just going to drain that out till we get all, so that's just fat left in that one. Now I'm going to combine these into just 2 syringes. And we're going to use what is called lure to lure. We're going to connect the 2 syringes together. And we're just going to pass the fat back and forth. This helps break up some of the big clumps of the fat. And now we're going to let this sit one more time. Kind of like a fine wine, we need to let it decant a little bit so that it separates out one more time. And then we'll do the other 2 syringes. All right, so now we're going to do step A. And what we're going to do is we're going to put the fat into port A here. I'm just going to clean that first. And we're going to put all this fat into port A. That's one. We have a total of about 60 cc, 60 milliliters of fat. And now we're going to add, and here is just some saline solution. We're adding that, and this is our first wash of the fat cells. So 250/76. That's pretty good. Okay, so now I need to add, we're at 250, so I need to add like 8 cc's of fluid. So after our first spin here, you see I've got my flashlight holding the bottom here, and you see the difference in the line there. We've got all the anesthesia at the bottom, we've cleaned the fat, and now we have a clean layer of fat. So now we're going to extract some of that fluid at the bottom, and then we're going to wash it again, spin it again, and then we're going to get a concentrated product. Okay, so now we're going to extract fluid from that bottom layer that I just showed you a picture of, and it's the same color. So this is just all the, we're purifying the fat, getting rid of all this color here. It's like, there we go, beautiful. Okay, so now what I'm going to do is in that same compartment, I'm going to put another tube of, make sure I'm on the same one here, and we're going to wash the fat again. So this is more saline going in. So now we're ready for our second spin. We're at 3:11:20. So we're going to do the counterbalance. 3:11:18. Here we go. So now we're counterbalanced to 3:11:37, so we're within range. And now we're going to do our final spin here. So we're on our final phase now, and now we're just extracting all the, you can see the difference in the color of the fluid from the first one that I extracted to this one here. It's much cleaner. And we're just extracting the fluid until we start to see fat. So that's 60. All right, I think that we're good. Yeah, so there's a little bit of fat here, so we're good here. Okay, so now what we're going to do is go to the final step where we extract the fat. The fat, and look, this is like fantastic. Textbook. Perfect. Beautiful. We'll extract as much as we can. Let it sit one more time. All right, now we're at the final product. This is all purified, concentrated, beautiful adipose-derived stem cell. So now I'm going to mix this with PRP, A2M, for probably one of the most powerful injections you can put. In this particular case, we're doing a knee, the knees and 2 shoulders. So here we are, the final product, 4 syringes, adipose-derived stem cell, A2M, PRP. This is extremely powerful regenerative injection for just about any joint in the body. In this particular case, we're doing knees and shoulders. So as we continue to raise the bar at Ultimate Medical Group, we just keep improving on the power of the injections because the companies we use keep coming up with better ways of concentrating natural cells. This is the elite program right here. So until next time, have a very blessed day.